Hello, I'm Darren Magee, and today's topic is looking at bipolar disorder. Now, if you like this video, if you find it helpful, please click like and please consider subscribing to my channel. But just as a reminder, this video is not a substitute for support from a mental health professional, nor is it a tool to be used to diagnose someone. Now, first of all, when we use the term bipolar, it's often a term that people use to describe someone who's maybe happy one minute and quite moody the next. But there is much more to it than that. Previously known as manic depression, DSM-5 described bipolar disorders as a brain disorder that causes extreme fluctuations in a person's mood, their energy levels, their ability to function. And the mood swings aren't really mood swings in the sense that they happen just like, say, the push of a button or the flick of a switch. The extreme lows, the extreme highs, these can take place over days, weeks, sometimes even months. And that term bipolar, now that refers to the swing between someone experiencing periods of great excitement, lots of energy, euphoria, known as mania or manic episodes. The other periods of intense sadness, the hopelessness, the lethargy, that's known as depression or depressive episodes. And there are three different categories of bipolar disorder. Bipolar 1 is a manic depressive disorder that can exist both with or without psychotic episodes. Typically, though there are always exceptions, the lows would last about 2 weeks, the highs would last about a week, and that cycle can go on for months if untreated. Bipolar 2 consists of depressive and manic episodes which tend to alternate. Now, they can be less severe and maybe not necessarily inhibit the person's day-to-day function, but the lows in bipolar 2 would be similar to that in bipolar 1. The highs, though, are what's known as hypomania. Now, to be diagnosed, these states have to last at least 4 days. However, they can last anywhere from, say, a few weeks to a few months. Lastly, there's cyclothymic disorder. Now, this is a cyclical disorder that has brief episodes of both hypomania and depression. These are milder highs and lows, but they cycle back and forward for maybe up to about 2 years. Now, when it comes to a disorder, I often think of a disorder as the impact it has on someone's day-to-day functioning, as well as the impact it has on their relationship with themselves and indeed other people. But according to DSM-5, to be diagnosed with bipolar disorder, a person must have experienced at least one episode of mania or hypomania. And to be considered mania, the elevated high mood must last for at least a week and be present most of the day, if not every day. To be considered hypomania, the mood must last for at least 4 consecutive days and be present most of, if not every day. Now, during this period, 3 or more of the following symptoms must be present and represent a significant change in that person's usual behavior. So the first one is inflated self-esteem or grandiosity. Now, this can look like they're being, say, loads of fun. They're very excitable, very generous, or perhaps even arrogant. They may feel indestructible or believe they're on some very important mission. Criteria number 2, there is a decreased need for sleep. So there's so much energy there, it's almost like the person just can't switch off, finding it hard to get to sleep or waking up early. Number 3, there is increased talkativeness. Now, my mother used to have this expression, I think fits this, talking a mile a minute. Now, this is maybe like going from one topic to the next, sometimes seeming as if they're not pausing for breath. Number 4, there's racing thoughts. Now, just like the talking, it's like the mind is leaping from one idea to the other, thinking about ideas, but not really thinking them through. Either that or it's like over-analyzing situations. Number 5, they are distracted easily. Now, this could look like, again, just jumping from one idea to the other, or maybe starting a project, starting to do something, but then just dumping it, leaving it, and going and starting something else. Number 6, there's an increase in goal-orientated, goal-directed activities or psychomotor agitation. Now, this could look like as if they have a lot of energy, they just can't sit still. Or maybe they're hyper-focused on something. Now, something that could be maybe trivial or irrelevant to someone else, but they are putting a lot of their time, energy, and effort into it. And lastly, criteria number 7, engaging in activities that hold the potential for painful consequences. Now, This could be acting impulsively, acting irresponsibly, say like unrestrained buying sprees, going crazy on eBay or Amazon or something, gambling. There's a lot of risk-taking behaviors. So that is the diagnostic criteria for the mania. The depressive side of bipolar disorder, that could be characterized by a major depressive episode resulting in depressed mood or loss or interest or pleasure in life in general. And according to DSM-5, a person must experience 5 or more of the following criteria, the following symptoms, for 2 weeks to be diagnosed with a major depressive episode. For the first one is depressed mood most of the day, nearly every day. Now this might be they're just withdrawing, they're locking themselves away, pulling the curtains, just lying in bed all day, isolating themselves, feeling generally discouraged and demotivated. Number 2, there's a loss of interest or pleasure in all, or almost all, their activities. Now, this could be their hobbies, their interests, sports they were playing, it could be work, but sometimes it can even be things like even just looking after their own personal hygiene, general household chores, everything. With everything, there's like a lack of motivation, a lack of interest. Number 3, significant weight loss or decrease or increase in appetite. Now, this could be, either they've lost their appetite completely or they can't keep away from the fridge. If there's a loss of appetite, if they're not really eating, now this could actually be one of the things that are fueling that lack of energy that they feel. Number 4, engaging in purposeless movements. Now this could be like staring into space, it could be pacing the floor, it could be staring at the television but not really watching it. Number 5, there's fatigue and there's a loss of energy. And as I mentioned a moment ago, if they're not really eating, not really going to get a lot of energy. But everything requires so much more effort. Even the simpler things, simple things just like brushing their teeth requires a lot of effort. It feels like it's a strain. Now there can be a lot of sleeping too much or maybe sleeping too little, but one way or another there is unrefreshed sleep. Number 6, feelings of worthlessness or guilt. Now this could be feeling like a drain, feeling as if they are a burden on everyone. There's intense feelings of not deserving anything, not even deserving help. So sometimes that person doesn't even really want to ask for it. Number 7, a diminished ability to think or concentrate or being indecisive. Now this can lead to a lot of procrastinating, second guessing, fear of whatever it's going to be. There's going to be awful consequences. It's going to be a terrible strain. Whatever it is, it will be the wrong decision. The consequences are going to be dire. And the thing is, the more someone procrastinates, the more they avoid things, the worse they tend to feel. So it tends to feed off itself. And lastly, criteria number 8, recurrent thoughts of death. Recurrent suicidal ideation without a specific plan. Now, this I would characterize as just thoughts of life not worth living. Somebody believing, everybody else would be better if they just weren't here. Now, I have to be clear on this. I think that there are times though, and it would depend on the person, it would depend on the severity, the duration, the frequency of the episodes. A lot of different things could be thrown in. I think there are times when someone really just gets to that point when maybe they really do start thinking of a plan to end their own lives. So that's the diagnostic criteria for bipolar disorder. However, in some cases there may be mixed episodes of depression, and mania. They're having them at the same time. Now, to date, the cause of bipolar disorder is still unknown. It is largely believed that there could be something genetic there, every bit as much as there could be environmental factors at play. And if there's a history of drug misuse, now some drugs can be a factor, they can trigger some of those episodes. I also think it's fair to point out that bipolar can also be comorbid with other disorders such as an anxiety disorder or ADHD. Now, men and women are diagnosed with bipolar in equal numbers, though the main symptoms of the disorder tend to differ between the two. For example, women may have milder episodes of mania, but more extreme cases of depressive episodes. Women also tend to relapse more often and are more likely to misuse alcohol than to, say, use drugs. Men, on the other hand, tend to experience more severe manic episodes and tend to act out impulsively whenever they're experiencing those episodes. They're more likely also with men for there to be substance misuse issues, and Men are less likely to seek help on their own. If someone reaches out to them, maybe that's different, but they're less likely to seek help on their own. They're also, with men, they're also more likely to die by suicide than women are. To date, treatment for the disorder typically includes a combination of both medication and psychotherapy. Now, that is a brief outline of bipolar disorder. Now, there's lots of things I haven't mentioned. If you want to include them in the comment box below, please, by all means, go ahead. If you like this video, if you found it helpful, please consider subscribing to my channel for future updates on mental health related topics. And until next time, thanks for watching.